The amount of weight a woman gains during pregnancy is really important to ensure that both she and baby will have the healthiest pregnancy outcomes possible. For this class, you're going to need to know, if given a scenario, how much weight a woman should gain during pregnancy based on her pre-pregnancy BMI. So when we look at weight gain, we use a pre-pregnancy BMI. Well, how do you calculate that? You're going to take her weight at a pre-pregnancy weight and then her height and calculate BMI like you've done before. Based on that number, then you're going to look at this chart and know whether or not where her BMI number fits and how much weight she should gain accordingly. So for this class on the exam, you won't be given the chart, so you're going to need to memorize these ranges for the different BMI categories. So the book calls them low, normal, high, and obese. Well, you could think about this as low is underweight, and then normal is the normal weight, a normal BMI, and then high would be overweight, and then obese is obese. That might help you to remember those a little bit better based on what you've learned previously in this class. And one of the things we get concerned about is whether or not women gain outside of these ranges. So these have been shown through research, depending on the pre-pregnancy BMI category. If that woman gains within the recommended amount of weight, she's going to have the best health outcomes. However, she doesn't. If she gains too little weight, then she's going to have potential for negative health consequences, especially for the baby. So if mom's not getting enough weight, that means baby's not going to be growing as a baby should. So we can see a baby that's small, which then increases risk for mortality or death of that baby. And we also can see that that's been linked with chronic diseases later in life as well. On the flip side, if mom gains too much weight, this can have some negative effects for her as well as for the baby. With the baby will just continue getting larger perhaps, and in that case increased risk for a baby that is needing to be born through a cesarean section or C-section because of the baby being larger than what the mom can deliver naturally through a vaginal delivery. So that can happen. We can also see that with excess weight gain, and with that I should say that leads to increased risk of chronic diseases for the baby later in life. And then also excess weight gain also makes it hard for mom to lose that postpartum, or harder, I should say, to lose that postpartum. And so then we get concerned about subsequent pregnancies if she has excess weight on and then she gains additional weight during a next pregnancy. That cycle may continue to lead to concerns about excessive weight even when she's not in pregnancy, and all the complications that can come with obesity. If you have any questions on this concept about calculating the pre-pregnancy BMI and thinking about how much weight a woman should gain, or the consequences of not gaining within those ranges, feel free to talk to me or to the TAs.